Hello everyone. Today we'll discuss the part 12 of the NEET quiz important questions, and our today's topic is the ear. So first try to solve the questions by yourself. So first of all, the lateral surface of the pinna is supplied by which nerve? It is the over here the upper 2/3 is supplied by the auriculotemporal nerve. The lower 1/3 is supplied by the greater auricular nerve, and the concha is supplied by the auricular branch of the vagus nerve. The cranial surface of the pinna is supplied by which nerve? So upper 2/3 is supplied by the lesser occipital nerve, lower 1/3 is supplied by the greater auricular nerve, and the eminentia concha is supplied by the auricular branch of the vagus nerve. Now what is the length of the external auditory meatus or the external acoustic meatus? So total is 24 mm in the length. The outer 1/3 is cartilaginous part, while the inner 2/3 is the bony part. And over here, out of 24 mm, the cartilaginous part is of 8 mm, okay, in length, while the bony part is of 16 mm, 16 mm in length. Where is the isthmus present in the bony part of the external acoustic meatus? So it is located at 20 mm deep in the bony part. Now in the newborns, where the bony canal is not developed, now this particular external acoustic meatus is represented by, so this EAM or the external acoustic meatus in the newborns is represented by tympanic ring. Okay. Now what is the arterial supply to the external acoustic meatus? So it is from anterior auricular artery, branch of maxillary artery, posterior auricular artery, branch of external carotid artery, and the deep auricular artery, which is a branch of the maxillary artery. Now the external acoustic meatus develops from the, it is an ectodermal derivative of the first pharyngeal cleft. Now what are the layers of the tympanic membrane? So it is basically 3 layers: outer, middle and the inner. Outer one is a cuticular layer of the stratified epithelium. Middle is the fibrous layer which encloses the handle of the malleus bone, okay, and the inner layer is mucosal layer which is covered by the columnar epithelium. Now what angle does the tympanic membrane makes with the floor of the external acoustic meatus? So it forms 55 degrees. Now what is the nerve supply of the tympanic membrane? So it is the tympanic branch of the glossopharyngeal nerve, auriculotemporal nerve and the auricular branch of the vagus nerve. Now which artery supplies the tympanic membrane? So it is the deep auricular artery, branch of maxillary artery, anterior tympanic artery, branch of maxillary artery, and the posterior tympanic artery, branch of posterior auricular artery. Now the venous drainage of the tympanic membrane is, okay, now outer surface and the inner surface. Now over here, if you know that tympanic membrane of course has two sides because it is somewhat like disc in shape, right? Disc or oval in shape, this particular tympanic membrane. So it has outer surface and the inner surface, right? So outer surface, the venous drainage of the outer surface, it is the external jugular vein, while the inner surface is actually drained by the transverse sinus and the pterygoid venous plexus. Outer cuticular layer of the tympanic membrane is originated from the ectoderm, while the middle fibrous layer of tympanic membrane is originated from the mesoderm, while the inner mucous layer of the tympanic membrane is originated from endoderm. Now how is chorda tympani nerve related to the tympanic membrane? So by inner aspect of the tympanic membrane in the upper half, it crosses the handle of the malleus and nerve is in between the fibrous and the mucosal layer. So by all this aspect, the chorda tympani nerve is related to the tympanic membrane. By how? Over here what happens is the inner aspect of tympanic membrane in the upper half, means in the inner part or the inner surface or tympanic membrane, this particular chorda tympani nerve is present in the upper half, okay, and then this particular nerve crosses the handle of the malleus bone, and then finally the nerve lies in between the fibrous and the mucosal layer of this particular tympanic membrane. The middle ear cavity contains which structures? So it contains ear ossicles, stapedius and the tensor tympani muscles and the chorda tympani nerve. Now what are the contents in the epitympanum or the attic? they are head of the malleus bone, body of the incus, and the short process of the incus bone. Now, what are the contents in the mesotympanum? So, they are handle of the malleus bone, long process of the incus, and the stapes. Now, which is the narrowest part of the tympanic cavity? So, it is the mesotympanum part. Now, which nerve pierces the floor of the tympanic cavity? So, glossopharyngeal nerve pierces the floor of the tympanic cavity. The tympanic plexus is located on which wall? So, it is located on the medial wall. The anterior wall or tympanic cavity is related to which structures? So, to the tensor tympanic muscles, pharyngotympanic tube, and the internal carotid artery. The posterior wall of the tympanic cavity is related to which structures? So, stapedius muscle, facial nerve, and the chorda tympani nerve at the posterior wall of the tympanic cavity. Now, which nerve passes lateral to the long process of the incus and the medial to the handle of the malleus? Means which nerve passes lateral to long process of the incus and medial to the handle of the malleus? So, chorda tympani nerve over here. Chorda tympani nerve leaves the ear through anterior canaliculus. Incudo-malleolar joint is which type of joint? It is saddle variety of synovial joint. Incudo-stapedial joint is which type of joint? It is the ball and socket variety of synovial joint. The facial nerve in the ear gives which branches? So it gives chorda tympani nerve, greater petrosal nerve, and the nerve to stapedius muscle as its branches. Tympanic plexus is formed by which nerve? So it is formed by tympanic branch of the glossopharyngeal nerve, superior and the inferior keraticotympanic nerves, and also from the branch from the geniculate ganglion. Now, which is the smallest skeletal muscle in the body? It is the stapedius muscle. At which week of intrauterine life the fetus can hear the sounds? So, the fetus can hear sounds at 20th week of intrauterine life. The safety quadrant of the tympanic membrane for the laryngotomy, it is the posterior inferior quadrant. Which is the smallest long bone in the body? It is the malleus. Now, which is the smallest bone of the body? It is the stapes. So, smallest long bone in the body, it is the malleus, while the smallest bone of the body, it is the stapes. So, today up till here, we will discuss about the further important notes and questions of further topics in our next video. Thank you so much.